Thank you for that introduction. I'm a chiropractor. I've been practicing in Ottawa for 12 years. I'm currently situated in Canada, where we have our clinic where we do chiropractic, acupuncture. We do a lot of rehab. What I wanted to start off with is just from a background, like people may be aware of what a chiropractor does. Maybe you've been to one before. But just as a brief synopsis, it's kind of like physical therapy. We're expertly trained in treating any sort of joint, muscle, nerve issue in the body. But as you would probably appreciate, when people are looking for a career or work in particular, you could have similar degrees, and then based on your experience, you start to develop a bit of a niche, a certain perhaps an interest that drives you there, or the opportunities that you're presented with. So very early on in my career, I had the opportunity to start working heavily in sort of like traumatic motor vehicle accident issues, workplace injuries. And that was my stepping stone in realizing the importance of posture. Because even though a lot of the patients that I was seeing were coming in primarily because of an injury or a traumatic injury, I started to notice a trend where people would bounce back from those injuries a lot faster if they had gone into the trauma, the actual mechanism of injury, in a better functional environment. And so that means partly that's posture, partly that's strength and conditioning, perhaps some mobility, flexibility. So I started to, on a private end, started to see more and more people that would benefit from postural correction. And that could be your average person. It could be an amateur athlete. It could be a competitive athlete. It could be a senior. So it's a very pertinent conversation to have. What I wanted to do today was briefly talk about the broader look at posture and why it should matter to the average person who is in the workforce, who's in a workplace where they have to do repetitive movements on a day-to-day basis. So the first question that I want to pose, and I do have things that I want to walk through, but I also don't want this to be a lecture. So I'd like to pose a very simple question to start, is what is posture to you? Anybody that wants to jump in can. I'm not able to see your faces anymore because I'm sharing the screen, but if Ahmed, you want to facilitate that, I'm happy. What is posture? What does that mean to you in particular? Anybody? So maybe I can pose a question here. Is it the way we look? Is it our aesthetics? And that would be valid. It's not it's a pigeonhole look at posture, but it's still an important thing to discuss. Every week I'll have people come in that are like, I don't like the way this bump is forming at the back of my neck. I don't like that, my mom or my dad, perhaps, who is now aging, tends to have a very rounded upper back. Aesthetically, I don't want to look like that. I want to look attractive. I want to look more upright. I want to be presentable. And this is true even for people looking for jobs. Maybe perhaps you're not interviewing in person as much as you would, but I think the way you present yourself goes beyond just making sure that you look nice, that your hair's done. I think there's a portion of posture that allows people to get past the physical demeanor. So if you're, walking in with poor posture, shirt untucked, that kind of stuff definitely leaves a lasting impression. So yes, posture is the way we look. It is our aesthetics. Is it the way we move? Is it our functional capacity? Functional capacity in the sense that, all of our workplaces have dynamic demands on our bodies, and more so even outside of the workplace. Is the posture allowing you to do things that you need to do, which could be your work, and you're like, hey, I love my job, but the only reason I'm doing it because I need to provide for my family. I want to have a comfortable life. I want to be able to retire and still be able to enjoy things that I want to do. So that's a need. And is your posture, your body's ability to move and function well, allowing you to do that? And then there's a want, perhaps outside of work, you may want to be involved in some sort of extracurricular activity. Maybe you're a weekend warrior. Maybe you're somebody that's just trying to lose some weight, but you're limited by your movement capacity. And a lot of that perhaps is rooted in what you're doing at the workplace. So posture is involved in the way we move. It is our functional capacity as well. Is it the way we interact with the world around us? And this kind of expands on the functional capacity part, but consider a very menial task. Like, let's say you're sitting in the car and you hear a horn and you need to turn around and look to the side. Do you have enough flexibility and movement to be able to turn and rotate and look back? This is neither a absolute want or an absolute need, but it is a movement that is required for you to interact with the world around you in certain situations. It could be something so simple as, let's say things are stacked at home and they're high up on a shelf. Can I do an overhead movement and actually reach for that object? Or am I so flexed forward in my neck and upper back that I have no shoulder elevation past a certain point? So posture is going to allow you or prevent you from interacting with the world around you in a meaningful way. And this last point is what I'm going to try to focus on a little bit more. Is posture a core determinant of our health and our vitality? So are you guys familiar with what vital signs are in the body? So for instance, is a vital sign. A resting heart rate should be at a certain level for the average healthy individual. Our blood pressure is a vital sign. Our lung capacity, our oxygenation. These all tell us that our systemic functions are, working in a way that is optimal. Posture, and this is why I'm so keen on speaking to people about posture, is because for the longest time, I think we've limited posture to just aches and pains. It's like, well, I work at a desk, so I leave home or I go home with some discomfort in my neck. And that's okay. That's just the nature of my work. Maybe I am more dynamically involved. I'm in labor kind of intensive work, and I go home and my back hurts. And I just chalk it up to this is normal for the kind of work that I do. But over a longer period of time, do we know if these postural strains that we're putting on our body are going to affect our vitality? Are they allowing us to age gracefully? Are they allowing us to get to a point where even despite our circumstances and our environment, we're able to be fully functional in the things that we need to do? So I'm going to make a huge argument that posture in and of itself is a core determinant of our health. Now, I'm the kind of person, and this is just my personality, I'm keen on getting advice and doing things better. If I can improve something, I want to improve it, but I don't want to be told how to do it. I want to understand why I should do it first. And maybe other people can resonate with that. It's like, okay, great. You're telling me I should correct my posture, that I should be more aware of my environment and what that's doing for me. But why? And the way I like to see it, I'm a visual person, is imagine if, we have a simple input and we have a simple output. And people that work in tech perhaps will understand this analogy. Very simple system. We have a very predictable outcome that's going to happen when we have a certain input. We would start to make that system efficient because there's very predictable outcomes that are going to happen from a health standpoint. And that's what I want to start speaking to people about posture in this lens. The bigger picture, the inner experience and the outer manifestation of your health is rooted in repeated behaviors. So the inner experience is perhaps how you feel. It's how your bodily functions are working. Are they optimal? Are they less than optimal? And the outer manifestation perhaps could be the way you look. We could talk about other determinants of health too, not just posture, for instance, that this rule applies to, because it's a universal rule, is that repeated behaviors lead to an expected or a predictable outcome. And that is both experienced externally, outwardly, and it's experienced internally. Can anybody give me an example of this principle, which is very universal in health, where you would have a repeated behavior and it would either lead to a positive or a negative outcome.
The way you
Cameron,
communicate.
go ahead.
I think I heard that dentists sometimes is getting some different pains because of their continuous posture all the day.
Yeah.
That's probably something if I can participate. Yeah.
Yeah, absolutely. I see dental hygienists and dental practitioners because their job requires them to constantly be working in a forward flex position. And often I find sometimes it's more of a leaning right or leaning left posture as well on a consistent basis. They'll all develop some sort of mid-back issue. And we'll eventually get to this, but your body has these transition zones. And I'd say the majority of postural challenges at the workplace take place in your mid-back and they take place in your hips. And everything else kind of is a consequence of it. But just to expand on this, for instance, physical activity is one of these repeat behaviors that has a very predictable outcome, lack thereof, or engaging in it. So of course, engaging in physical activity, which is great for your body, has predictable positive outcomes. And having a lack of physical activity, perhaps you have a sedentary job, you are mentally fatigued by the time you're done, you go home, you crash, you check out on the weekend, you're busy with family, you're generally moving around, but you are not doing physical activity to push your body outside of its comfort zone. You are in what we call homeostasis. Your body loves to stay at a reasonable, predictable level. And it'll try to maintain that for you as best as possible, even if it is inappropriately low or not optimal. So you almost have to stress the system externally to allow yourself to come out of that comfort zone and improve your homeostasis. So physical activity is one, nutrition is another, repeat behavior. If you're constantly eating improperly, you are going to gain weight. You are going to feel tired and fatigued. You are going to, ruin some of these other vital signs we were talking about that are determinants of health. But again, you can make a change. This is a lifestyle choice where then that correction of that behavior now leads to positive outcomes. You have mental health. Perhaps your job is extremely stressful. And you do not have good mechanisms in place to manage that stress. And you are allowing yourself to internalize a lot of things that take place. It could be negative self-talk. It could be, things that lead to other problems from a stressful environment. It could be manifestation of anger or emotional dysregulation at the workplace or outside of the workplace. So mental health, again, is a behavior. It is a repeated behavior that you need to, one, be aware of if you are struggling with it, and then two, come up with strategies to change that behavior in whatever capacity you're able to in your environment. Sleep is another. It is a huge component of health and one that is often ignored. Again, people who are in the work field and perhaps are maybe earlier on in their careers, but I've seen people carry this behavior well into their retirement even, is, there's this hustle, this grind. Like I need to excel in what I'm doing at the cost of perhaps losing sleep. And that could be a conscious decision. You're like, no, I'm putting in extra hours and I'm only getting set amount of sleep. Or it could be, again, tied into the previous mention of mental health and the lack of regulation of stress and just not being able to fall asleep at night and continuously getting shorter windows of sleep. There was this great talk that I was listening to earlier in the year, and they were basically talking about how, we have our REM and non-REM sleep. They said a cycle is about 90 minutes. So the average person, somewhere in the ballpark of 90 minutes, is going to awaken feeling refreshed. And it's such a simple thing once you become aware of it. It's like, okay, let's say if I have 6 hours in my night and I'm trying to plan to see when I can go to sleep and when I can wake up effectively, wake up fresh and energized. I'm going to want to wake up at the end of my 90-minute cycle. I'm not going to want to wake up at 50 minutes or 55 minutes. So if I know what time I need to be up, I'm going to plan my night and go to sleep at a certain time so that I can get that full cycle. It could be 3 cycles of sleep. It could be 4 cycles of sleep, but I want to wake up at the end of the cycle. But in any case, it's a repeated behavior that can have a huge impact. And the last one that we're going to talk about is posture. Posture is a repeated behavior. You can think of it like 2 things. One is static posture. This is how we learn about it in anatomy. A neutral posture of the human body is somebody standing straight, their palms are facing forward, you know, their the opening of their ear is in line with their shoulder, which goes just in front of their elbow, then behind the knee, through the hip, into the ankle. We could say, okay, this is static, good posture, but nobody's standing in that position all day. So what I like to speak to people about is the importance of addressing also the dynamic nature of posture throughout the day. And that varies from person to person, but dynamic posture is really more important than static posture and trying to be perfectly aligned all the time. Okay. Now let's just run through a few of these benefits before we start talking about, you know, what postural strains you guys should be keeping an eye out for. So expanding on why it should matter to you, the benefits of posture are huge. There's improved performance. So better alignment allows for more efficient movement and reduces the risk of injury. This is what I was explaining to you earlier. When I started working with the population that had traumatic injuries, we found that there was a pattern clinically where people bounce back from injury better. I'm not talking about like fractures and stuff. If a bone breaks, it breaks and it's going to have its own healing time. We're talking about soft tissue injuries. We're talking about progressive degenerative changes in the body. How quickly can you bounce back from episodes of pain? Really determined or is based on how anatomically sound and functional you were going into that injury. Enhanced breathing. You know, good posture opens up your chest cavity, allowing for deeper and fuller breaths. Your diaphragm, which is a big muscle underneath the lungs, underneath the rib cage, is a hugely ignored muscle group when we talk about posture, because people will be like, yes, I want to work on my shoulders, I want to work on my core. But both the diaphragm and the pelvic floor muscles, which are basically the bottom part of our pelvis, are hugely involved in posture from the trunk. So when we have people that are hyperflexed at their mid-back, we also find them to be flexed in their hips. And they're basically flattening the angle between their diaphragm and their pelvic floor, whereas it's supposed to be more of a scissor shape. So when we have a better lordosis in our low back, we have a reasonable kyphosis in our mid-back. The angulation of these anatomical positions allows us to have good functional lung capacity. So you might argue, well, I'm not really an athlete, so maybe this is not a big deal for me. But imagine the aging process. Like, do you want to age gracefully? Do you want to have vitality at the end of your life where you're still able to enjoy things that you want to do and are otherwise independent? So enhanced breathing is a huge benefit of making an effort to correct your posture. Increased energy levels. So proper alignment reduces strain on your muscles, joints, and conserves energy. Absolutely. From a mechanical standpoint, it's true. If I am sitting at a desk 9 to 5 and I'm allowing my body to stay in this position, I'm expending more effort because my muscles in my upper back, with all the weight that is going forward, need to work extra hard to hold on to that weight. And it is not like you're exercising. This is not like a workout that has benefit, but it is strain on the body and it depletes energy. And so you're more better to be in a more neutral, functionally good anatomical position when you're in that environment. The other thing that comes to mind with this too is actually there was a study many years ago that was done on students, or for students primarily, because they were looking at the relationship between a lack of movement in general and cognitive abilities, like your ability to, and this is so important for people in the workforce, is you know, static postures. It could be sitting, it could be standing for long periods of time. They found have a negative impact on your cognitive abilities, your ability to concentrate, your ability to recall things effectively, your ability to multitask. And they were looking at a student population and they were saying perhaps we need to revisit how we teach kids at a younger age, constantly sitting down at the desk. At least that's how I was taught growing up. My daughter is now 10, but you know, she has a very dynamic learning environment, so they do move around a lot. But the reasoning for this is we have, because we're moving entities, we have a lot of nerve endings in our joints that are constantly sending information to the brain. So for instance, these are called proprioceptive nerve endings. They're allowing your body or your brain to know where every joint is in space. So when we diminish that stimulus and we're not moving around in a sedentary posture, we're actually not stimulating the brain as much as we could had we been more dynamically active in our environment. Better circulation. Good posture prevents compression of blood vessels, improving circulation. I would say, again, this is hugely important for the aging population. It's something that is preventative that you can work on at an earlier point, but the negative consequence of it is usually felt later on. There's a lot of, your body's very resilient, so these are not things that at a young age you'll start to experience, but it is a slow progressive issue that eventually at some point your vascular integrity is not going to be as good. And so these tissues, these blood vessels, they'll compress more easily, and that can lead to other problems as well. Continued benefits: reduce pain. Of course, it minimizes the stress on your joints. It actually reduces the wear and tear. Everybody's degenerating. As soon as we reach skeletal maturity, beyond that, majority of it is a very slow progressive degradation of joint and tissue health. And if it happens in a symmetrical, good environment, no problem. In an athletic population, even if it happens asymmetrically, maybe somebody's pitching a ball and they're constantly using their right arm, or they're golfing and their swing is always to one side, or a soccer player that strikes always on the one. Yes, they're going to have asymmetrical degenerative problems, no problem. But you and I, in an average environment, should be degenerating or trying to degenerate in a healthy fashion. So you either degenerate comfortably or you degenerate uncomfortably. And so reducing pain as part of correcting your posture is making sure that you are degenerating at a good rate and comfortably and not prematurely. Improved mood. This is huge. How many times have I heard people, because, we try to go a little bit more involved with people when we see them for pain. It's like, I like to ask questions. How has that impacted your quality of life? And sometimes people are forthcoming. Sometimes you have to dig a little bit more. But the average person that's coming in with neck pain and headaches, I'd be like, what triggers your headaches? Stress, lack of sleep. I find I get a headache at the end of my workday because I'm working on a screen. What can you do to help me? Okay, great. But their bigger why there too is like when you start asking, it's like, well, how's that impacting your quality of life? Are you happy with your relationships? Do you go home and are you engaged with your significant other in the way that you want to be? Are you able to connect with your kids the way you want to? Are you able to be an engaged and active member of your community more than just existing? And a lot of people will start to realize that the further huger, broader implications of their pain has affected their mood. It's affected their personality over a long period of time. And chronic pain, even at a lower, we think of chronic pain as this issue that only happens to this small population group because they were had a traumatic injury and then they weren't able to bounce back from it. Chronic pain is pain that's been present for more than 3 to 6 months. And on a repeated cycle, it has an impact on your nervous system. It actually changes a lot of parameters, and part of that is your mood and your emotional regulation. So it's huge. Enhanced digestion. Upright posture prevents compression of your abdominal cavity, aids digestion. Aging gracefully, maintaining good posture helps prevent your mobility and flexibility as you age. I'm going to focus on that a little bit more because posture, again, is sometimes gets this bad rep where it's like, well, posture leads to stiffness and I need to be flexible. The reality is, and we'll talk about this a little bit more, is it's more nuanced than that. We want to focus on functional mobility as opposed to stiffness and lack of flexibility. And the risks are essentially...
Hamza, there is a question in the chat.
Okay, go ahead.
Are you open to answer questions now, or do you want to keep this at the end?
I don't know. It's I think probably at the end it's better because then we can expand on it a little bit more and know that we have the time.
Sounds good. Okay, we'll keep that for the end. Okay, thank you.
Okay, thank you.
Okay.
But yeah, continue to ask questions if you have in the chat, and we'll definitely touch on them. So the risks of poor posture, essentially everything opposite to what we were just discussing: chronic pain, reduced mobility, increased risk of injury, fatigue. We have breathing difficulties, digestive issues, poor circulation, premature aging. And aging is also something that is so misunderstood. You know, we tend to think that aging is this linear path. Everybody's on it and we're all aging the same way. And the impact of that aging process is going to be felt similarly. You could have gone to your doctor and complained about something, and perhaps you get told, well, it's because you're aging, and that's normal. But if I take a cohort of even 10 people of all the same age, they don't have the same challenges related to aging. So aging is a factor, it's a determinant of health, but it's very low on the scale. And often we give it too much of an importance. But the problem with that is it takes the power away from us. We have no control on the aging process, at least from a timeline perspective. We're all only getting older, but lifestyle changes are huge, and they can change the impact of the aging process on your health and on your posture, ability to move, functional capacities. So key points, just to bring it home. Posture impacts physical activity, of course. So poor posture is not just, hey, I'm getting stiff. It also affects your physical health. It can lead to chronic pain, reduced mobility, and other health issues. This is huge. Workplace habits carry over. So this is not something you and I get to decide for ourselves, that I have this, you know, physical demand on my body at work, but I can chuck it in the bushes and go home and be a different person. No, you carry that physical stress with you into your home life. You carry that into your other things that you want to engage in on a day-to-day basis. And it doesn't have to be rocket science. At the end, when we start talking about things that you can do, consider doing things in the opposite environment of what you're currently forced to do for work. So if you sit 9 to 5 at a desk and you end up with a rounded upper back, shoulders that are internally rotated, head that is forward, do everything the mirror opposite. That's your stretch. That's your sort of an attempt to functionally create movement in an area that was forced to stay stiff for a long period of time. So anything that extends your mid-back is going to be great for you. Anything that externally rotates your shoulder is going to be good for you. Anything that helps to bring the head back in a resting position is going to be good for you. Good posture enhances performance. Absolutely. Small changes make a big difference. And this is also a very, very key, important concept for two reasons. One, I was touching on this earlier. There can be this sense of like overwhelm when somebody tells you to change your lifestyle parameters to improve your health, because there's so much that you could be doing. We almost have this like inaction that happens because you're like, one, I don't know where to start. And two, I don't know if it's enough. You know, so what's the point of doing it in the first place? Let's just keep everything status quo. But the smaller changes that you will start to make actually have a snowball effect. And this is true for your nutrition. It is true for your physical activity. It is true for your sleeping regulation, your mental health. It is true for your posture. So for me, every time I speak to somebody, I'm like, you know what? Pick one thing. Even if it's like a 5% change, it doesn't have to be dramatic. Do it consistently, because it's the consistent change in behavior that's going to eventually lead to that positive outcome. And you will find it has a cascading effect, like a domino effect. You do one good thing for yourself, and you start to find it easier to do other things that are also beneficial. So simpler, smaller adjustments to your workplace and habits can significantly improve your well-being. Okay, the last few things I want to touch on before we get to questions and answers. Functional mobility is more important than stiffness or flexibility. And again, this is a discussion because important discussion to have, because a lot of people focus on, I'm stiff in my hamstrings, let's stretch my hamstrings. I'm stiff in my neck and upper back, I'm just going to do some like static stretches and try to loosen it up. No. The first thing you need to understand is that your body is a dynamic moving element, what that has zones of tightness and zones of flexibility, and it needs to have both for you to be able to function the way and move the way you're supposed to. So not everybody can be flexible all the time. And in fact, people that are hyper flexible, meaning too flexible, gymnasts and other people that perhaps have trained in flexibility, have their own set of mechanical problems. And people that are too stiff or hypo-flexible have their own challenges. So we need to have this finer balance depending on the environments that we're going to be in. Is like, well, where can I create a little bit more of a functional, mobile element in my body, in my spine, in my peripheral joints, and where can I create strength and conditioning where I may be tight, but it is good for me because that zone is supposed to be tighter in the first place. So try not to think of it as like stiffness or flexibility. And the other thing I want to show you just quickly is the complication of how your body is involved in coupled movements. So for instance, when we start talking about purely from an anatomical, you can say academic or research standpoint, we look at the body's movement in 3 planes, the X, Y, and the Z. And in 3 dimensions, there are basically 12 simple movements that the majority of the regions of the body can do, but they are coupled movements. If I am turning my head to the right or I'm turning my head to the left, it's not just my neck that's moving. It's my upper back that has to allow me to get that movement. Same thing with my lateral flexion, same thing with my flexion and extension. So I can have somebody that has a forward head posture. They're like, you know what, doc, I've been working on it. I try to stretch it. I'm doing all sorts of things to the neck, but they're ignoring the upper back and they're not finding that they're improving their posture. So there's coupled movement in the body. There are 12 movements of the rib cage as well. So when we're assessing posture, we have to go into a little bit more detail. It's never the same problem for everybody, but there are some key things that I'll mention that are pretty universal across the board just because of the repeat environments that we're in. And same thing is true for the pelvis as well. So you cannot have one postural issue in a zone and not cause compensation elsewhere. So if you want to correct that specific postural problem that is bothering you, you have to address the other coupled areas that are also accommodating for it. Let's do a quick test here, actually. This is a good time to do it. So suppose when you guys are sitting down right now watching me, I want you to take your right hand and I want you to place it on your left shoulder and then take your left hand and place it on your right shoulder. Effectively, what you and I have done is we have internally rotated our shoulders, and that naturally creates some rounding in our mid-back. From here, I want you to try to turn to the left and then turn to the right. And you'll find that you'll have some restriction in how far you can turn. Now, comparatively, if we now go and place our right hand behind our head, our left hand behind our head, we have effectively done some degree of external rotation. That naturally pushes our mid-back in, coupled movement. And then all of a sudden, when we turn, we get a significantly higher degree of movement. And then the problem is, if I look at across the board, majority of people that are doing desk work, they have very similar postural challenges. And that is going to be the rounding of the upper back, the internal rotation of their shoulders. So being tight in external rotation, not having the ability to externally rotate fully. They're going to have tremendously stiff mid-backs. They're going to have forward head carriages. So there are things that you would need to do to alleviate that stiffness or lack of mobility in one zone, and then strengthen others to accommodate for that postural correction. Practical tips for improvement. So the number 1 tip, take home, is just start today. And it sounds, easy, and it is. You have to pick just one thing from a postural standpoint that you can change. It doesn't have to be big, but it'll start to have a positive impact. So ergonomic workplace setup. I don't know if you've never had that checked before for you, either through an employer or a third party, it is a good idea for you to get some feedback on the current setup that you have. Or perhaps if you're not currently working and you're going to be going into an environment where you know that you have these particular physical demands, knowing what to do when you get there is also important. Regular breaks. Nothing can beat your body's ability to self-regulate if you simply just change the environment that you're in. So again, not rocket science. You've been sitting for a long period of time. We talked about the upper body, just this rounding of the thoracic spine, internal rotation of the shoulder, head forward posture. Get onto the ground. Take something that is, a reasonable height and firm. It could be a foam roller, yoga block, anything like that. Place it on the ground in the mid-back. Allow your mid-back to extend. Get your head onto the ground. Externally rotate your arms and do a couple of, shoulder elevation movements. You've effectively taken your body into a complete opposite position of where it has been, and maybe it took you 5 seconds, 10 seconds. And you do that if you're able to. We recommend every 30, 60 minutes. Sometimes it's not realistic in your working environment, but basically think of taking regular breaks, and these breaks don't have to be long. They're literally less than 30 seconds in duration and just doing things that are of the opposite nature. If you sit for a long period of time, you're going to develop tightness in your hip flexors and actually weaken your abductors, which are the muscles that bring the hip away from the midline of the body. So, just getting up from your chair and doing a lunge to open up the front of the hip and getting down nice and low and trying to do some, movements of the hip to open up the sides is going to be hugely beneficial. Stretching and exercise, you can do this outside of your working environment, but, generally a good stretching routine, precedes a strengthening routine. So you want to be able to functionally stretch. We're not talking about static stretches. I'm not a huge fan of those. They have their place, but generally we're talking about warming up the body in a dynamic way, continuously moving around before you do some strengthening exercises. Mindful awareness, paying attention to your posture throughout the day and making corrections as needed is huge. And then this is, coming up last, but I think this is huge. Consult a chiropractor or some other form of physical therapist for personalized and advice and treatment, because the reality is your things that your body's been through in the past, the things that you were engaged with when you were young, the kind of injuries that you had, have to be taken into account when we start making recommendations for correcting posture. There is benefit to, let's say, you Googling or YouTubing top 10 postural correction exercises. Perhaps some of them are going to be of benefit to you, but I feel like you're going to miss the mark. Even I'm going to share with you a video that I prepared a few years ago, but one that I constantly use to this day, because it's a great starting point for somebody that wants to correct their posture, but is extremely general. And it's appropriate for majority of people, but it will not and cannot fix all your postural problems. It is the proper assessment that leads to that. So I'm just going to quickly show it here. I can share the link with Ahmed. So if any of the attendees want to watch this, it's about 15 minutes. It goes through a series of movements that are to people who want to correct their posture, and they're easy to follow along, doesn't require a lot of equipment. Yeah. Let me just go. Okay. So I think I stayed on track, but this would be a great time to open it up for question and answers if you guys have any. Oh, and the last thing I want to mention,
first,
no matter where, if you have questions particular to your specific needs and the environment that you're in, I'm happy to do like even a virtual consult. I'm located primarily in Ottawa, of course, but you would simply need a camera for us to do some sort of an assessment from a postural standpoint, or be able to show me your ergonomic or your workspace setup for me to make recommendations. And if you carry any sort of health coverage or extended health benefits, you're able to bill it through that as well. Yeah.
Awesome. Thank you so much, Dr. Hamza. This is definitely a lot of, eye opener and, lots of wisdom that you shared with us today. And you made us all feel bad about, our sitting habits for sure. So thank you so much. I think we have some questions in the chat, and Samer also has his hand raised. Samer, if you don't mind, I'll just, take that question in the chat first, and then I'll hand it over to you. So there was a question about, how many hours typically we should sleep, and is it like 8%, or does it vary from person to person?
Yeah, so the reality is it does vary. A lot of research now suggests it is the routine and rhythm of your sleep that is more important than getting a set number of hours every single night. And it is more important for you to get, let's say the average person at minimum, an adult, should get about 4 to 5 cycles of sleep. So let's say a cycle is 90 minutes. There would be a lot of argument to say that you don't have to have those cycles all in one consecutive order, as long as you're making it up at some point in the day. So let's say you had a busy night and perhaps you only got, 3 cycles of sleep. You would try to make up the other 2 at some point. And that could be a nap. It could be catching it up the next day. But it is that repeat behavior of not having enough sleep. So again, some people can regulate really well with 6 hours of sleep. Nobody needs exactly 8. You know what I mean? So it depends on the person. It varies. But having a repeat behavior of not getting enough sleep where your body's not resting has far-reaching effects, and especially, let's say, for men and women alike, but in a certain age group, we don't realize, but our sleep actually regulates our hormones. And so people start to have a lot of issues that are related to a lack of good sleep. And that could be from a growth hormone standpoint. It could be testosterone for men. It can impact your digestive functions hugely. And of course, mental fatigue and cognitive ability and all that. So not set 8 hours. Think of it as cycles, 4 to 5 for the average adult, and that it's the repeat pattern that's more important. Look at it in a week. How much sleep did I get? And if you're sort of in that 4 to 5 cycle range, you're good.
Awesome. And there's I think a follow-up question on the chat about the best time to sleep and wake up to catch quality sleep time.
Yeah, so this is also interesting because, again, that varies from person to person. It varies on where they live in the world. But we're creatures that are highly dependent on the cycle of daylight and nighttime. And we sometimes think we can, change the system, but we cannot. It's internal. But sometimes, let's say even a work environment, somebody might be working nights and they have to sleep through the day. It's a huge challenge because from a hormonal standpoint, there are natural rhythms that our body needs to follow to regulate and self-regulate well. So I would say, depending on where you are, right now we're in the summer months here in Ottawa, the nights are getting shorter and the days are getting longer. So it's very difficult to go to sleep at, let's say 9 o'clock because the sun's not even gone down yet. It's still bright out. And then it comes out earlier in the day. But generally speaking, from a health standpoint, it is more important for you to sleep during nighttime hours and to make sure you get the majority of your sleep in that time when the sun is down and it's dark out, because a lot of your hormones are being regulated based on the stimulation of sunlight. So then when you go out the next day, there's a certain rhythm your body's aware of. This is daytime, this is nighttime, and it's going to want to regulate those hormones. But if you never sleep when it's dark out, that is a problem. So I would say timing doesn't matter. Again, at the end of the day, it's majority of your sleep should be in nighttime hours though. So you
Awesome.
can't,
thanks so much.
I'm going to do 1 cycle of sleep at nighttime. I'm going to make up 4 during the daytime. You may be forced to do it if you work nights, but it's not ideal.
Awesome. Thank you. I think Samer, go ahead, please, and then Ash.
Yeah, thank you very
You're
much.
on mute. Yeah, go ahead.
Thank you very much for giving me the opportunity. So my question, Dr. Hamza, I'm trying to link what you have presented with a practice that we have in human resources. During my work in employee relations, we are very concerned about anything that is called repeated moves by the employees. So whenever an employee is trying to or like attempting to do a repeated move on a daily basis, we have a red flag and we have an attention to that. So how come these repeated moves is not good, while when we are doing practice or sport, we are actually doing repeated moves like 10 times on a daily basis, we are repeating certain moves or behaviors. How come this is negative and this is positive? Would you please enlighten me with a few things?
So I would argue that neither is positive, actually. We think of it from an athletic standpoint, we may say that it's positive because it leads to a desired outcome, which is that this person participates in sports and is otherwise able to function the way they're expected to function, and we cheer them on for doing so. But this person this is stress on the body. It's repeated behavior, particular to a set of joints that you're moving. There's going to be natural degradation that happens over a period of time. I think the only difference, because I work with a lot of workplace injuries, and from an employer standpoint, as an HR standpoint, I think you're trying to cut down liability, right? So you want to make sure that this person that is doing repeated tasks has an opportunity to avoid injury and still be able to function in that role. So you would consider that repeated task a little bit of a negative thing. So you're trying to find an alternative for it. But in sport, even that repeated activity still, if you look at it, it's still a physically stressful demand on the body, and it has negative outcomes. But it's like, risk benefit ratio. Maybe if you're a competitive athlete, you're happy to take on that risk because you know that the benefit and the reward is significantly higher. But we see people come in with issues they think are related to aging. I always like to question my patients that have knee issues or hip issues, but only on the one side. And I'm like, we're bipedal creatures. You and I are always walking on 2 feet. So why is it that you developed arthritis in one knee and not the other knee? Why is it that your hip gave out first on one side, not the other side? So unless it was an athletic population, I would say, okay, it makes sense. You were straining one side more. But you and I, or let's say in a workplace environment, it could be somebody that was forced to stand and their repeated behavior was simply standing, but they developed a habit of leaning on their one hip because they're getting tired and lazy and fatigued. They're not getting enough breaks. All of a sudden, they're tilting their hip. They carry that tilt out of the workplace. They're continuously wearing down one side more than the other. So I would say both are negative, but one has at least can be viewed more positively, right?
That's amazing. A reflective question, if you don't mind. So most of the workplaces now is also paying attention to chiropractic or physiotherapy or massage or these things. And like in our employer also, we have this insurance card that is covering a certain limit for these things.
Yeah.
So my wonder is like, do you issue like as a center, do you issue like receipts that can be claimed by insurance? Can we refer our employees to benefit from your center in this? Would you please give us some more information, and how much would the assessment cost as well?
Right. So yes, to answer that first question, we do provide receipts. Basically in Ontario, the licensed practitioners in health, whether that's a physiotherapist, chiropractor, massage therapist, can provide receipts to get reimbursed from these insurance companies. I will comment briefly on this sort of insurance parameter. I would always encourage people to consider the insurance coverage as a means to an end where, because it's blanket coverage for the same group of employees that are covered by that plan. But you, of course, bring your own health history into the mix. So one employee could be 60, the other employee could be 35. They're all covered by the same group policy. They all have the same maximum coverages. So sometimes the coverage is not appropriate for the need of that person. So I would say it's a stepping stone. It helps you to supplement your care. It is not meant to be like an end all be all. But yes, we provide receipts. Our typical assessment at the clinic is $150, depending on where the person's coming from. If I ever do like a talk, because I used to do a lot of these, but we used to do them in person. I would go into offices. We'd have people after a general meeting stick around. We used to go in with lunch and stuff. So we'd always make an offer. So if somebody wants to come in through a particular talk, we reduce the assessment to $47. This is true for even that virtual consult. If somebody wants one after I do a talk, we reduce it to $47 as a first initial assessment fee. And then after that, it's typically $55 or $70 per visit, depending on what we're doing with that particular person.
Thank you very much. Very interesting information. Thank you. And if you share your contacts on the chat, we will be able also to circulate it to everybody. Thank you.
Yeah, no problem.
Awesome. Thank you so much, Tamer. Ash, go ahead.
Yeah, I just had a follow-up question on regarding sleep. And that was if let's say somebody, like I personally deal with this, is I wake up feeling well rested, and then after probably like an hour or two, I feel this fatigueness. Just wondering, what could be certain reasoning for that, essentially. I do want to mention that usually if I were to do some physical activity, like let's say if I go to swim and all that, and it has become such a quote unquote issue for me that if I don't do any physical activity like swimming, usually I feel pretty groggy, pretty fatigued throughout the day. So I'm just curious, if there is some underlying issues with sleep or anything, and it really doesn't matter how long I sleep, that I should be really looking into. Just wanted your thoughts on that.
It's a good question. I think the first thing I'll reiterate is what I said earlier, because that's such a simple thing you can try to tweak and see a change in your ability to feel fresh after you've slept. is consider the 90-minute cycle and try to plan your sleep as much as you can to end at the end of a cycle. And it won't always be perfect, but try to get as close to it as possible. So even if it is a couple of hours of sleep, you want to make sure you are hopefully waking up at the end of a REM sleep, not in the middle of a deep sleep cycle, because that dysregulates the body. You'll wake up more groggy. You'll feel, not fresh. The other thing to consider is how stimulated were you before you went to bed? People talk about the issue with technology and having access to it on our bed, particularly stimulation to the eyes and how it stimulates the brain. So there's certain filters you can use on your phone and stuff like that would prevent your body to be cognitively more alert as you go to sleep, because you could be tired enough that you actually go and you pass out. But because of the fact that you were not in a restful state prior to sleep, you will still wake up a little bit more groggy. And I think that's what that physical activity is doing for you. It perhaps is allowing you to exert energy and get to bed, perhaps feeling a little bit more cognitively depleted and allowing your body to have some restful sleep. And the last thing I would mention is nutrition. It is important to also discuss the relative time when you should stop intaking food compared to when you go to sleep, because your body still has to digest that process. And it's a subconscious effort. So you and I could decide, I'm going to have, let's say I was late getting home and I ended up having a big meal at 10 o'clock at night. And I've got an early morning. I'm going to try to go to sleep at 11. Maybe I'm exhausted enough that I actually do fall asleep. My body still has to digest the food that I ate. I don't have to be consciously aware of it. But there is this level of alertness and regulation that is happening. It is not actual restful sleep that you're getting. And then we could go even further into diet and consider, what did you eat before you went to bed? So generally it's recommended that you have smaller snacks if you need to before bed, that you do not have anything that is more complex and heavy that your body would have to break down significantly. So I think all of those things, but the biggest thing for me that I recommend to everybody that's struggling with being alert is consider the 90-minute cycle and try to plan when you go to sleep relative to when you need to wake up, and make sure it's somewhere in the ballpark of ending in that cycle.
Okay, yeah, thanks. No, that's actually something I'm aware of the REM cycles. It's just I haven't really specifically paid attention to that, but I think I'll look into it. So yeah, and I actually just for the benefits of others, I did come across, I think there's an app called Sleepy Time or something like that, where you can just input like what time you want to sleep, and then just automatically just gives you certain times of, okay, this is the time that you want to target, and that I think considers, I know it considers the REM cycles.
Yes.
So I may want to just look and pay close attention to that. Yeah, I'm okay. Yeah, and then and just going back to that physical activity aspect of things, is usually what happens is so right now I'm feeling, just even right now I'm feeling a little fatigued, groggy, but I know that if I were to go and swim for like half hour or something, that I'm refreshed and I'm able to just get through the day. So there's that's I mean, it's good because it just forces me to go and do some physical activity normally wouldn't happen, but it's just there's this constant dependency and aspect. Maybe it's a mental thing, I don't know, but yeah.
No, I think there's some truth to it. I was saying earlier about that research study about cognitive input to the body from physical movement and how movement stimulates the brain. So absolutely, there's truth to it. And I wouldn't even say that's when we say dependency, it's a negative connotation. But when you're doing something that has a positive impact on your health, like physical exercise, swimming, I wouldn't say dependency necessarily. I think that's a good, predictable outcome that you're getting from an input.
Yes.
That hopefully you enjoy. It doesn't feel like a chore.
No, I do. Yeah, it doesn't feel like a chore. No, absolutely not. No, fair point. After fair point to that. Yeah. Cool. Thank you.
Awesome.
Appreciate it.
Thank you so much, Ash. Thank you so much, Dr. Hamza. I think we're getting on the time in our journey to job search. So Thank you so much. Any final thoughts, Dr. Hamza, before we
No,
end up
honestly,
here?
just reiterating what you just said, it seems like a lot because even though it was a short talk, I shared a lot of information. Don't let that feel overwhelming. Take that one thing, somebody's asking about sleep. Perhaps that's something they want to change. The talk was on posture. Consider where you can make that smallest of changes that's going to have an impact on your physical health, but also all the other benefits that we talked about. And I'll share the link. I don't know if I should do that here, if you're able to distribute it after the that link to the YouTube video. Simple movements, and pick and choose which ones you need to do. You don't have to do all 15, but at least something that you can start taking actions with.
I love it. Yeah, if you can share this link, I'll do a post on LinkedIn with the selfie and share this link,
Okay,
so that everybody can benefit. And again, I'll put it in the YouTube video when I upload it as well.
Okay, excellent.
Awesome.
Thank you.
Thank you so much, Dr. Hamza. Thank you so much, everybody, for joining us today. Again, stay positive, stay proud. The job search is the journey. Posture, readiness is a journey too. It takes, a village, and, small habits, it makes a big impact. So thank you so much again, Dr. Hamza. Thanks, everybody, for joining. Enjoy the rest of the Sunday and see you next Sunday. And enjoy the rest of the week. Thanks.